Most of the time when people come in here, they're going to have their shoes on. I'm okay leaving them on. When we do assessments for SFMA, shoes off. For FMS, shoes are on. So when they're doing their stuff in here, I'm okay with shoes on. Okay, but shoes off will make this more of an effective stretch. Okay, there's two parts to the calf stretch. Okay, one is for the Gastrocnemius, one's for the Gastrocnemius, the other one's for the Soleus. Okay, so hands up high for me, right leg back. I literally get on my hands and knees, or I sit on the ground when I'm having them do this with it too. Okay, so get your leg a little further back for me. Okay, Patrick. First thing, I want this heel lined up with this toe. The second you say that, they start moving this foot over to try to get this foot lined up with this foot. It's this foot and toe, and I actually literally touch him and say this heel and this toe. Is he lined up? No. Move your heel out towards me. Okay, he's going to feel like he's pigeon-toed, but he's actually lined up straight. Okay. Now, the second cue I'm going to give him, literally push your heel into the ground while you try to straighten your knee out. See the difference what he just did there? Okay. This is a chance for all those ACLs that aren't quite got extension yet, okay, or the people that can't, when they do toe touch, they just let their knees bend and you just can't get that. This is their chance to stretch their back of their cuff of their knee, as well as the gastroc and that whole posterior chain. So I literally want him to think about pushing his heels into the ground and pushing his knee out straight, okay? This is like the calf stretch we've always done, but people tend to butcher it down here and they don't get that knee straight. So I want this gastroc. If they don't feel the stretch, move it back further. If it's too much, they move it up a little bit more. If these people that get so far back their heel can't get to the ground, that's too much. Bring them a little bit more forward, okay? Hold 30 to 60 seconds in that position, okay? The second stretch, I basically tell them, say, okay, let's take your leg, let's move it halfway to the wall here from this position. So bring your foot forward to my toe. You can move that foot out to the side. I really don't care what it does, okay? Now what did Patrick do? He immediately brought his heel in, but he fixed it and he brought it back out. So now I want heel in line with toe again, okay? There you go, that's not lined up. Move this out, move your heel out for me, right there. And help him with that. They can't see, he can kind of see it, but he has trouble seeing it. Your heel's gonna stay on the ground, bring your knee forward for me. Now, I want he's gonna try to stretch his knee, and you do need this, Patrick, okay? He needs his knee in front of his toe. The tendency everyone's going to do is they're going to bring their knee to the inside and they're going to dive their knee in, okay, like we talked about, okay, with Samantha hurting her ACL. I want knee over second toe, and he's going to lean on it. And he can even take his right hand and put it on the bottom part of his quad, and you can kind of lean on that a little bit and just try to get your knee in front of your toe, okay? So heel in line with toe, heel stays on the ground, knee over second toe, leaning on, he should feel this in his lower calf and Achilles tendon, okay? If someone feels it all in the front of their ankle, guess what? That's when you talk to me or Greg, okay? Because that person's got an anterior impingement, okay? We might have them stretch through that, okay? But I'm going to talk to them about that when we do it, okay? They should feel this lower calf and Achilles. Where do you feel that, Patrick? Mostly where? In the front where? The quad, okay. What's limiting you forward? I'm not going to assess Andrew, but as he goes forward, he wants to bring his knee in. I'm going to make sure that knee's there. So they kind of have to play with their hip when they're doing that, okay? Get this one right, okay? Because otherwise it's just a pain in the butt and they're not stretching anything. And they're just compensating for their pattern over and over again, which is not good, okay? One other thing you can have people do, think about tightening up your tummy muscle. So now it's stability, right? So not kind of. I'm trying to get him to engage his core, which will hopefully let his calf go a little bit, and you might feel like he gets a little more stretch like that, okay? So that's a little trick that we'll do, okay? So that's the two calf stretches, okay?